a lot of times what ends up happening is that there can be a lot of misinformation, or patients can end up looking at or reading or gaining knowledge from sources which can be spurious sources. And a lot of times, uh, the, the the treatment team, the physician team may not always be able to, or the doctor team may not always be able to understand or identify what is going on. Why is it that the person is constantly feeling low, unsure? Because there's so much information which is coming at people these days. We have so much information available on Google, on different platforms, and so much information that comes to you from different people in your own life, that it can keep on taking away from the individual who has that medical health related concern to stay focused on what is being shared by them, with them, by the treating team as well. So to maintain that focus and to keep channelizing their thought process and helping them remember that the only aspect that they need to focus on is the information that is being shared with them by the treating team is what is most crucial, and they need to keep on following every process to the T, which is what is going to ensure the best recovery for them, becomes very, very critical. And ensuring that compliance is something which is maintained becomes a very significant part of a psychologist's role when they're working in the consultation liaison space. That is something which becomes very crucial when you're meeting patients who are admitted in, or whether even if they're coming as outpatients, when they're coming to healthcare, to healthcare facilities, to make sure that compliance of treatment is being followed, that their misconceptions, myths are being busted, that if they have any questions, they're being constantly pushed and encouraged to go and talk to their treating doctors so that they do not make any kind of misinformed choice, becomes very, very crucial. And this becomes a very significant space in which mental health professionals tend to operate. What becomes also an additional part of the role of psychologists or mental health professionals when they're working within, especially when they're working with in collaboration with doctors who are working within this physical health related concern space, is looking at prevention. There are a lot of aspects which can be taken care of if individuals are provided with the right kind of information. And that preventive aspect is something which can be focused on by psychologists who are working in collaborations with the medical teams as well. Looking at aspects of sleep hygiene, looking at smoking cessation, looking at stress management, basic things which a lot of times needs to be reinforced, becomes very important in ensuring that people are able to take the right kind of approach in maintaining their motivation to take care of their own selves. Lifestyle management becomes a very crucial aspect as a result, in order to ensure that people are able to take care of themselves and do not develop these kind of illnesses in the first place. And in fact, another very, very big role when we're talking about the mainstream of psychology is particularly in looking at aspects of a recovery from traumatic experiences, which can happen to patients many a time, especially if they've been if there has been any sort of um, loss of functionality for them, if they have been a part of any significant accident, if they have been diagnosed with a significant illness, which can be a jarring experience for them, or even if there has been some sort of a grief or a loss, which which patients or the families are experiencing at that point in time. These also become very significant aspects on which professionals who work within the mental health space can come in and provide significant services for, in order to ensure that people are being able to take care of themselves. Patients, when they are going through these experiences, need to be provided the right kind of support. They have to be helped to develop an approach which involves taking things one step at a time, making the decisions that they need to, keeping on moving forward, reinstating their support systems, finding ways to go back, re-engage with their life, being able to process the information that they're constantly getting about what life is going to look for them. That whole process of adjustment can be very difficult and can require a lot of time. And this is something that we end up seeing very often. In fact, if I were to take the example of someone that I'm working with recently, who went through a regular, who had to go through a surgery for a knee replacement, believed that the recovery should happen within 3 months. That's what she felt, that she's going to be able to come in, and the bending of the leg, the full recovery process would be aided. It would be perfectly fine within 3 months. She should be absolutely normal. But in her case specifically, somehow because of certain previous incidents, the recovery has been a slower process. So she's in month 4 currently, and it's still going to take the next 2 or 3 months more for her to be able to fully bend her leg and the 90-degree angle that it needs to get to. And to be able to ensure that she's not losing her motivation or her hopefulness or running away from the pain that keeps on coming up for her, becomes something which become very crucial to ensuring that she's continuing to do the things that she needs to, whether it is to go back to her physio sessions on a daily basis, whether it is to go back to the doctors and meet them and have conversations with them, which can end up being very difficult because there is a sense of feeling that, okay, I wish this was different. I wish I was fully there and things would be completely fine. But to keep maintaining that motivation and that drive to not give up becomes very crucial. And that is where a mental health professional like I could step in to help ensure that, those are the things which the patient does not give up on.